Hi guys, Dr. Jason here with Chirovolution, and today I wanted to go over some common questions regarding chiropractic. So the first question I have is, what is chiropractic? Now, a lot of people think of chiropractic as just something that deals with neck pain, back pain, or maybe something else in our body that hurts, right? Now, chiropractic is a little bit more complex than that. So our brain and our spinal cord are controlling every single function in our body. They're literally telling our heart to beat, lungs to breathe, food to digest. They control our hormones, our immune system, all that good stuff that we don't think about. Our brain, our spinal cord are constantly controlling. And they do that through the nervous system, right? So normally the bones in our back should be properly aligned, but sometimes those bones can misalign, and when that happens, it places pressure on those nerves. So what chiropractic is, it's an in-depth way of locating those misalignments, gently moving those bones back into proper alignment so that we are taking pressure off of those nerves so the brain and the body can communicate the way that they're intended to. Now, chiropractic is going to help our body heal and function better. And the next question is, how does that happen, right? So a lot of times when these misalignments are happening, they're placing pressure on nerves that say they're going to the lungs, right? And if a nerve is interfered going to the lungs, sometimes you could see breathing issues like asthma or allergies, right? So a lot of people will suffer from, let's say, headaches and migraines, right? So a lot of times we feel this pressure and this tension in the back of our head, and if we place our hands and place pressure on that, sometimes those symptoms can go away. Now what's happening is, with this bone being misaligned, it's causing tension, those muscles to tense up to kind of protect itself. Now with chiropractic, once we adjust that bone, we can let the tension go away on its own, and that is gonna let that headache or those migraines go away naturally, right? So the next question is, does the adjustment hurt? And the answer is no. The adjustment, when done correctly, should not hurt at all. When we are finding that primary misalignment, gently correcting that misalignment so that we're restoring communication between the brain and the body, when done correctly, shouldn't hurt at all. Now, the other good thing about our office specifically is we use an instrument-based technique called torque release technique. So there's no twisting, cracking, or popping. So that also leads it to being a very gentle, specific adjustment that won't hurt you. So two other common questions are, how often and how much do I need to come in, right? So this is very individually based. So once someone comes into our office, we see how their nervous system's functioning, we see what their structure looks like, and we determine based on those how often someone needs to come in. So let's say we looked at someone's structure and there was a lot of degeneration, a lot of arthritis. That person's gonna need more care than someone who comes in with a perfect spine, perfectly functioning nervous system, no issues. Obviously, those two people are gonna need varying amounts of care, right? Now, how does degeneration start? So say we're 5 years old and we're riding our bike, we fall off, hit our head, we hear a crack, maybe we get a concussion. So these bones are in improper alignment at that point. So fast forward 20 years, now our body's been stuck in this improper position. So the goal of chiropractic care is to get the body to shift back to where it should be. Now, all these years of improper alignment is what leads to that degeneration. I kind of say it's like a tread of a tire, whereas if the tread is uneven in one spot, it's gonna wear the rest out quicker. So same with our spine, if it's improperly aligned, it's just gonna wear out quicker than what it should. Now, the good news is it doesn't take 20 years to correct that issue. It is gonna take some time and repetition to get back to where we should be. And again, that is all dependent on your case and your care and your goals as well. So how much does care cost? That all depends on how often you need to come in and based on your scans and your structure and your ultimate goals. So what's really awesome is that here at Chirovolution, we do specific payment plans for each individual family. So instead of having to swipe your card and pay every single time that you come into the office, we can come up with a payment plan and payment option that works best for you and your family. Because what's most important to me is that people don't view chiropractic as a luxury. They view it as a way of life, a way of healing, right? So we want to be proactive with our health. So if your spine, which is protecting your brain and your spinal cord, is in proper alignment and we take that pressure off of those nerves, your brain and spinal cord are going to be able to help you function at 100%, not only when it comes to being out of pain, but also your whole body function. And that's the goal of my office. Chiropractic shouldn't be something where you come 3 times a week for the rest of your life. It should be something where we're finding the root cause of your issues, getting rid of that issue, and then working to maintain that issue. So once that initial investment in effort is put in to get out of symptoms, then we work on maintaining that problem, maintaining that issue, and maintaining that proper alignment so that we don't have these big flare-ups again throughout the rest of our life. So again, I'm Dr. Jason with Chiropractic. Have a great day.